What are the key environmental factors that can negatively affect animal health, and how can these factors be mitigated to improve the overall well-being of the animals? Answer: several environmental factors can negatively impact animal health, including temperature extremes, poor air quality, inadequate space, and noise. Animals require a stable and appropriate environment for optimal health, which includes maintaining appropriate levels of temperature, humidity, ventilation, and cleanliness in their living space. Temperature extremes. Exposure to high or low temperatures can cause stress or illness. For example, extreme heat can lead to heat stress in animals like pigs or dogs. Providing adequate cooling or heating systems, such as fans or insulated barns, can help mitigate this. Air quality. Poor ventilation can lead to respiratory issues, particularly in confined spaces. Regular cleaning of air ducts and the use of air purifiers or proper ventilation systems can improve air quality and prevent respiratory diseases. Space. Overcrowding can cause physical and psychological stress. It's important to provide enough room for animals to move comfortably, which is especially crucial in research and farming environments. Noise levels. Excessive noise can cause stress, leading to health problems like hypertension or behavioral changes. Reducing noise in animal handling environments, such as the use of soundproofing materials, can alleviate this. Discuss the critical practices that must be followed to prevent zoonotic diseases and cross-contamination during animal handling in a veterinary clinic. Answer: zoonotic diseases are infections that can be transmitted from animals to humans, and cross-contamination is the transfer of pathogens between different surfaces or animals, which can facilitate the spread of disease. Veterinary clinics, due to the close contact with animals, require strict biosecurity protocols to minimize these risks. Key practices include hand hygiene. Veterinarians and staff should wash hands thoroughly with soap and water after handling each animal, or use hand sanitizers containing at least 60% alcohol if soap and water are unavailable. Use of personal protective equipment, PPE, gloves, masks, gowns, and eye protection must be worn during procedures that involve close contact with animals or animal body fluids. Sanitization of equipment and surfaces. All tools, cages, and surfaces that come into contact with animals should be disinfected after each use with veterinary-approved disinfectants that are effective against zoonotic pathogens. Separation of animals. Sick and healthy animals should be housed separately to prevent the spread of infectious diseases. Isolating animals suspected of having zoonotic diseases is critical. Training and education. Staff should be educated about the importance of hygiene handling protocols and the potential risks of zoonoses. Mr. Thompson is a researcher working with laboratory animals. He needs to conduct a series of medical procedures on the animals, but he is unsure how to handle sedation and anesthesia to ensure both safety and ethical compliance. What should Mr. Thompson do to ensure proper procedures are followed in this situation? Answer: in this scenario, Mr. Thompson must adhere to ethical and legal guidelines to ensure that sedation and anesthesia are performed safely and humanely. The following steps should be taken. Consult ethical guidelines. The use of anesthesia and sedation should be in accordance with the ethical guidelines for animal research. For example, the Australian Code for the Care and Use of Animals for Scientific Purposes outlines the necessity for minimizing animal pain and distress during research. Proper training and certification. Only qualified personnel should administer sedation or anesthesia. Mr. Thompson should ensure that all staff involved in these procedures have appropriate training and certification in veterinary anesthesia. Monitoring of vital signs. During sedation and anesthesia, the animal's vital signs, heart rate, respiratory rate, temperature, should be continuously monitored to detect any signs of distress or adverse reactions. Post-procedure care. After the procedure, animals should be observed until they fully recover from anesthesia. Adequate pain relief should be provided based on the nature of the procedure and the species involved. Follow-up with ethical review boards. Mr. Thompson should also ensure that any research procedures involving sedation and anesthesia are approved by the institution's Animal Ethics Committee in line with both ethical and regulatory standards. Relevant laws guidelines. The National Health and Medical Research Council (ARC) and the Australian Code for the Care and Use of Animals for Scientific Purposes provide detailed guidance on ethical animal research practices. How can animal handlers in farming environments implement sustainable practices to reduce their environmental impact while maintaining the welfare of the animals? Answer: sustainable practices in farming are critical not only for environmental preservation but also for improving the quality of life for the animals. Key practices include waste management. Proper management of animal waste, such as manure, can prevent contamination of water and soil. This can include composting or using manure as fertilizer in a controlled manner. Energy efficiency. Installing energy-efficient systems in barns and animal enclosures. G. Solar panels. LED lighting can reduce the carbon footprint of animal care operations. Sustainable feed. Providing animals with sustainably sourced feed can reduce the environmental impact of farming. This involves selecting feeds that are produced with minimal resource usage and in ways that do not harm the environment. Water conservation. Implementing water-saving techniques such as rainwater harvesting or efficient irrigation systems ensures that water resources are used efficiently without waste. Biodiversity conservation. Protecting the natural habitat surrounding animal enclosures can maintain biodiversity and promote ecosystem health, benefiting both the animals and the environment. When handling aggressive or frightened animals in a clinical setting, what specific techniques can be used to ensure both the safety of the handler and the welfare of the animal? Answer: handling aggressive or frightened animals requires a calm and methodical approach to prevent injury to both the handler and the animal. Techniques include restraint techniques. Animal handlers should be trained in appropriate restraint methods, such as using a muzzle or a leash to control aggressive or frightened animals. Restraint should be firm but not painful, ensuring the animal's safety. Calming techniques. Using calming tools such as pheromone diffusers or soft voice tones can help reduce the stress of the animal. In some cases, sedation may be necessary, but this should only be done under the supervision of a veterinarian. Avoiding sudden movements. Sudden movements can startle the animal, increasing aggression or fear. Handlers should use slow and deliberate movements to reduce stress and avoid injury. Minimizing noise and distractions. Creating a quiet and calm environment can help to soothe frightened animals. Loud noises and chaotic surroundings can exacerbate stress and aggression. Behavioral assessment. Understanding the animal's body language and behavior is essential. Aggressive signs include raised fur, growling, or baring teeth. Recognizing these signs allows handlers to assess the animal's level of stress and adjust their approach accordingly. What are the core ethical principles that must be followed when conducting animal research, and how do these principles guide the treatment of animals in research settings? Answer: the core ethical principles in animal research are based on the threes: replacement, reduction, and refinement. Replacement: researchers should use alternatives to animal testing wherever possible, such as computer models or cell cultures. Reduction: the number of animals used should be minimized to achieve the research goals. Researchers should use statistical methods to ensure that the minimum number of animals are involved in studies. Refinement: procedures should be refined to minimize pain, suffering, or distress. This involves improving the way animals are cared for and handled, as well as ensuring they receive proper medical attention. Ethical research must be approved by an institutional animal ethics committee, ensuring that the research meets these ethical standards. Additionally, animals should be treated humanely throughout the study, and pain relief should be provided when necessary. Explain the importance of monitoring vital signs during sedation and anesthesia in animals. What are the potential consequences of failing to monitor these signs? Answer: monitoring vital signs during sedation and anesthesia is crucial to ensure the safety and well-being of the animal. Key vital signs to monitor include heart rate. An abnormal heart rate can indicate that the animal is experiencing distress or a negative reaction to the sedative or anesthetic agent. Respiratory rate. Decreased respiratory rate or irregular breathing patterns can be a sign of insufficient anesthesia or impending respiratory failure. Blood pressure. Blood pressure is an important indicator of circulatory health. Hypotension can result from excessive sedation or anesthesia and can lead to organ damage. Temperature. Temperature should be carefully monitored to prevent hypothermia or hypothermia, both of which can lead to serious complications during anesthesia. Failure to monitor these vital signs can lead to complications such as overdose, respiratory distress, cardiovascular issues, or even death. This is why regular monitoring, using appropriate equipment like pulse oximeters and ECG machines, is essential for the safety of the animal. What ethical considerations must be taken into account when choosing animal species for research studies, and how do these choices impact the study's outcomes? Answer: choosing the appropriate animal species for research studies involves several ethical considerations. Species appropriateness. The species selected should be suitable for the scientific objectives of the study. The ethical principle of replacement encourages the use of species that are less sentient, such as invertebrates when possible. Animal welfare. Research involving species known to experience pain or distress should prioritize minimizing these effects, ensuring that the study is justified and conducted under the highest welfare standards. Conservation status. Researchers should avoid using endangered or vulnerable species unless absolutely necessary, as this could threaten their survival in the wild. The choice of species impacts the study's outcome by influencing factors such as the animal's susceptibility to disease, its response to treatment, and its genetic variability. Ethical research prioritizes the well-being of the species used and ensures that their participation is scientifically valid. What steps can be taken to reduce stress in animals during routine veterinary examinations and procedures, and why is this important for both the animal's welfare and the accuracy of the exam results? Answer: reducing stress during veterinary procedures is crucial for both the animal's welfare and the quality of care. Key steps include familiarization. Allowing the animal to become familiar with the clinical environment beforehand can reduce anxiety. This can include short visits or using pheromone sprays. Gentle restraint. Restraining animals using the least amount of force necessary helps prevent trauma and distress. Positive reinforcement. Using treats, praise, or other forms of positive reinforcement during procedures can help associate the clinical environment with positive experiences. Minimizing noise. Keeping the clinic environment calm and quiet helps prevent anxiety-inducing stimuli. Pre-procedure sedation. In some cases, mild sedation may be used to calm particularly anxious or aggressive animals, ensuring their safety and comfort. Relevant law guidelines. The Australian Animal Welfare Standards emphasize minimizing pain and stress during veterinary procedures. These practices are essential for ensuring ethical treatment and obtaining accurate medical results. How can animal care facilities integrate sustainable practices into their daily operations while also ensuring animal welfare? Answer: animal care facilities can integrate sustainable practices by focusing on resource conservation and environmental responsibility without compromising animal welfare. Some approaches include energy-efficient buildings, using renewable energy sources such as solar panels, and then ensuring buildings are well insulated reduces energy consumption. Water management. Implementing water-saving practices such as low-flow faucets and water recycling systems ensures that resources are used efficiently. Sustainable feeding practices. Sourcing feed that is produced through sustainable practices, including organic or local feed, reduces the environmental impact of animal care. Waste reduction. Composting organic waste and reducing plastic use minimizes landfill contributions and creates nutrient-rich soil for gardens or farms. Eco-friendly cleaning products. Using non-toxic, biodegradable cleaning agents ensures that animals are not exposed to harmful chemicals. What are the key principles of effective communication in an animal care setting, and how can these principles be applied to ensure positive outcomes when dealing with clients and colleagues? Answer: effective communication in animal care settings is fundamental for creating a safe and productive environment. The key principles include active listening, ensures that the speaker feels heard and valued. This is essential when communicating with clients about animal health concerns, as it helps gather complete information and builds trust. Clarity and conciseness. Information should be shared in a clear and direct manner, avoiding jargon. For example, when explaining an animal's care plan to a client, it's crucial to simplify complex veterinary terms. Nonverbal communication. Body language, facial expressions, and tone of voice all contribute to the message being sent in animal handling. This can also include observing animal behavior and responding to nonverbal cues. Empathy. Acknowledge and respect the emotions of both clients and colleagues. When dealing with a distressed client about their pet's health, showing empathy can alleviate anxiety and build rapport. Why is accurate record keeping crucial in animal handling, and how does it contribute to both animal welfare and regulatory compliance? Provide examples from animal care environments. Answer: accurate record keeping is vital in animal handling because it ensures that all actions, treatments, and observations are documented, which serves multiple purposes. Animal welfare. Clear records allow animal care professionals to monitor an animal's progress over time, track health issues, and identify patterns in behavioral care. For example, if an animal shows signs of stress, the record of previous handling sessions may reveal triggers. Regulatory compliance. Many countries and states have specific animal welfare laws and regulations, such as the Animal Welfare Act in the US, that require detailed documentation to ensure compliance with humane treatment standards. Liability protection. Proper documentation protects animal care professionals from legal challenges by providing evidence that procedures were followed and animals were treated according to industry standards. An example from an animal shelter could be a record of vaccinations, treatments, and behavioral assessments, ensuring that every animal receives the proper care. Mr. Thompson, an animal handler at a public zoo, is faced with a situation where a visitor insists on petting a lion, despite clear signs of the animal becoming agitated. The visitor refuses to follow the handler's instructions to maintain distance. What should Mr. Thompson do in this situation to uphold professional conduct and ensure safety for both the animal and the visitor? Answer: Mr. Thompson should prioritize both the safety of the animal and the visitor in this situation. Here's what he should do. Calmly assert authority. Mr. Thompson should firmly but calmly explain the risks of approaching the agitated lion, emphasizing the potential harm to the visitor and the stress it may cause the animal. Use de-escalation techniques. If the visitor is becoming confrontational, Mr. Thompson could use non-threatening body language and a calm voice to avoid escalating the situation. Seek support. If the visitor still refuses to follow instructions, Mr. Thompson should seek assistance from a supervisor or security personnel to ensure that the situation is handled in line with zoo policies and regulations. Follow safety protocols. The zoo likely has established safety protocols for handling such situations, which Mr. Thompson should follow to ensure compliance with occupational health and safety laws, such as ensuring the lion is safely contained or moved if needed. When handling animals for educational demonstrations, what are the critical factors to consider in order to ensure the safety of both the animals and the audience? Answer: the safety of both animals and the audience during educational demonstrations depends on several factors. Animal temperament. Only animals that are well socialized and accustomed to human interaction should be used in demonstrations. For example, using a calm, trained animal reduces the risk of unpredictable behavior. Handling experience. Handlers should be experienced in managing the species involved in the demonstration. For instance, a handler should know how to safely approach and restrain an animal to prevent injury to themselves or others. Audience control. It is essential to manage the audience, particularly children, to prevent them from getting too close to the animals. This can be achieved through clear instructions and barriers. Emergency procedures. Handlers must be prepared for potential emergencies, including sudden changes in animal behavior or an audience member being injured. Having a first aid kit, communication devices, and a trained support team available is crucial. Environment setup. The demonstration area should be securely enclosed, ensuring the safety of both the animal and the audience. For example, ensuring that small animals are safely contained in pens during public demonstrations is a key consideration. How can time management techniques be applied in an animal care setting to improve efficiency and ensure the well-being of animals? Answer: in animal care settings, time management is essential for maintaining animal welfare and optimizing operations. Some techniques include prioritization. Tasks should be prioritized based on urgency. For example, feeding and cleaning tasks should take precedence over less critical tasks like equipment maintenance. Batching similar tasks. Grouping similar activities together, such as preparing food for all animals at once or performing routine checks, helps save time. Delegation. Delegating tasks, where possible, to other qualified staff allows for better coverage and ensures that all aspects of animal care are attended to in a timely manner. Time blocking. Allocating specific blocks of time for certain activities like training sessions or animal health checks ensures that important tasks are not overlooked. For example, if a shelter is experiencing a surge in animals, time management skills could be applied to streamline feeding schedules or delegate cleaning duties to maintain cleanliness and animal care without delays. What are the main safety precautions to take when interacting with animals in a petting zoo to prevent injury to both the animals and the visitors? Answer: safety precautions for interactions in petting zoos include supervision. Ensure that trained staff are present to monitor both the animals and the visitors. Staff should intervene immediately if visitors do not follow the rules. Animal suitability. Only animals that are calm and accustomed to human interaction should be part of petting activities. For example, a goat or a rabbit may be ideal, but a large or aggressive animal should be avoided. Visitor guidelines. Clear rules should be communicated to visitors, such as washing hands after petting and refraining from sudden movements or loud noises that could startle the animals. Animal enclosures. Animals should be housed in enclosures that prevent them from being overwhelmed by excessive interaction, ensuring they have spaces where they can retreat if they feel stressed. These measures ensure the safety of both the visitors and the animals and help maintain a pleasant experience for all parties involved. How does the behavior of animals in zoos or aquariums impact the handling strategies used by animal care staff, and what considerations should be made when designing enclosures for these environments? Answer: the behavior of animals in zoos or aquariums plays a significant role in how they are handled and housed. Considerations include species-specific behavior. Different species exhibit unique behavioral traits that can influence how they should be handled. For example, animals that are territorial may require more space or barriers, while social species may thrive in groups. Understanding these behaviors helps animal care staff manage interactions more effectively. Environmental enrichment. To prevent boredom or stress, animal enclosures should include enrichment activities that stimulate natural behaviors, such as climbing structures, hiding spaces, or water features. This helps ensure that animals are mentally and physically engaged. Safety measures. Enclosures must be designed with safety in mind, such as using materials that prevent escapes or injury and creating secure barriers between visitors and animals. Additionally, staff should be trained to handle animals safely considering their species-specific traits. For example, designing a large enclosure with climbing structures and natural foliage for primates reflects an understanding of their need for physical and social stimulation. How should animal behavior be managed in public exhibitions to ensure the safety and welfare of the animals and the public? Answer: animal behavior in public exhibitions should be managed by observation. Continuous monitoring of animal behavior helps identify any signs of stress or aggression. This allows handlers to intervene early to prevent incidents. Safe barriers. Physical barriers such as fences or glass enclosures prevent direct contact between the public and animals. These barriers must be designed to withstand the animal's natural behaviors like climbing or digging. Training and conditioning. Animals should be trained to tolerate human presence and follow specific behaviors on command. This reduces stress and enhances their ability to participate in exhibitions without becoming agitated. Escape plans. There should be clear procedures in place in case of an emergency, such as an animal escaping or behaving unpredictably. Staff should be familiar with these protocols to ensure a quick and safe response. By managing animal behavior proactively, public exhibitions can be both educational and safe for everyone involved. What are the ethical responsibilities of an animal handler when it comes to making decisions that affect the long-term welfare of animals in their care? Answer: ethical responsibilities include advocating for animal welfare. Animal handlers must always act in the best interests of the animals, ensuring that their needs are met and that they are not subjected to unnecessary stress or harm. Transparency. When making decisions that impact an animal's welfare, handlers should provide clear and honest explanations to their supervisors or clients, particularly when changes in care protocols or treatment plans are necessary. Continuous learning. Ethical animal handlers stay informed about the latest welfare guidelines and best practices, ensuring they are using the most up-to-date methods to care for animals. Informed consent. If decisions involve the animal's future care, e.g., euthanasia or rehoming, the handler must communicate the situation respectfully to clients, offering all relevant information to help them make an informed decision. This ensures that the handler is upholding both legal and moral standards in their professional role. What are the legal implications of improper documentation in animal care settings, and how can handlers ensure compliance with relevant regulations? Answer: improper documentation in animal care can lead to legal issues such as non-compliance with regulations. Animal care facilities must comply with regulations such as the Animal Welfare Act (US) or similar laws in other countries, which require accurate records of animal treatment, health, and behavior liability risks. If a documented issue arises, e.g., an animal injury or illness, poor or absent records could make it difficult to defend actions taken, potentially resulting in legal liability. Accurate and timely reporting. Handlers can ensure compliance by maintaining detailed, accurate, and timely records, including health logs, vaccination records, and behavioral observations. This demonstrates due diligence in animal care. By adhering to these practices, handlers mitigate legal risks and contribute to the overall integrity of animal care operations. What is the importance of personal protective equipment (PPE) when handling animals, and how does PPE mitigate the risks in different animal handling scenarios? Answer: personal protective equipment (PPE) plays a crucial role in reducing the risks associated with animal handling, protecting workers from physical injuries, zoonotic diseases, and environmental hazards. Depending on the situation, different types of PPE are needed. For example, gloves protect handlers from bites and scratches, while steel-toed boots provide protection from hoof bats. In livestock handling, respirators are essential when working with animals in environments where airborne pathogens, e.g., zoonotic diseases like tuberculosis, are a risk. PP also minimizes exposure to chemicals, especially in veterinary settings where medication or disinfectants may be used. To ensure optimal protection, proper maintenance and correct usage of PP are essential. For instance, gloves should be inspected for holes before use and disposed of immediately after handling animals to avoid contamination. Respirators must be cleaned and properly fitted to ensure effective filtration of harmful pathogens. PP also promotes hygiene and sanitation, critical in maintaining a disease-free environment. Regulations, such as those from Safe Work Australia and the Occupational Health and Safety (OHS) Act, mandate the use of appropriate PPE where risks are identified to minimize injury and illness. Explain how hygiene and sanitation practices contribute to infection control in an animal care environment, and list key steps to follow in maintaining a clean and safe environment. Answer: hygiene and sanitation practices are essential in preventing the spread of infectious diseases in animal care environments. Proper cleaning and disinfection reduce the risk of zoonotic diseases, which can be transmitted from animals to humans. In an animal care facility, high-touch surfaces, animal enclosures, equipment, and tools must be disinfected regularly using appropriate cleaning agents to ensure they do not harbor harmful pathogens. Key steps in maintaining hygiene include regular cleaning. Surfaces such as cages, stalls, and floors should be cleaned thoroughly and waste materials should be removed promptly. Disinfection. After cleaning, surfaces should be disinfected using approved disinfectants that target specific pathogens. Hand hygiene, hand washing or use of hand sanitizers after handling animals is essential to prevent the transfer of diseases. Equipment maintenance. Tools and equipment must be cleaned and sterilized after each use to prevent cross-contamination. Isolation protocols. Sick or potentially infected animals should be isolated in separate areas to prevent disease spread. Sarah is a farm worker responsible for handling livestock, including cattle. One day, she notices a group of cattle appears to be lethargic and are showing signs of a respiratory infection, such as coughing and nasal discharge. What steps should Sarah take to ensure the health and safety of the animals and herself in this situation? Answer: in this situation, Sarah should follow a series of steps to ensure both her safety and the welfare of the animals. Immediate isolation. Sarah should isolate the sick cattle from the rest of the herd to prevent the spread of the infection. PPE usage. Sarah should wear appropriate PPE, including gloves, a mask, and possibly eye protection, to minimize the risk of zoonotic disease transmission, especially if the infection is viral or bacterial. Notify veterinarian. She should contact the farm's veterinarian immediately for further diagnosis and treatment. Record keeping. It is important for Sarah to document the symptoms and any actions taken, as this information may be crucial for treatment or further investigation. Follow farm protocols. Sarah must follow the farm's specific protocols for dealing with disease outbreaks, including any quarantine or treatment procedures. Sanitation. After handling the infected cattle, Sarah should thoroughly clean and disinfect any tools, equipment, or PPE used and wash her hands thoroughly. What are the key factors to consider when handling working animals, such as horses or dogs, in agricultural settings? How does their behavior influence handling techniques? Answer: when handling working animals like horses or dogs in agricultural settings, it is crucial to consider their natural instincts, temperaments, and specific needs. Horses, for example, are prey animals with a flight response, so handlers must be aware of their body language to avoid causing panic. Calm, steady movements and the use of voice commands can help in controlling them. Dogs, on the other hand, may be working animals bred for specific tasks, e.g. herding, and handlers must ensure they are trained properly to respond to commands. Key considerations include animal temperament. Understand the animal's typical behavior and temperament to avoid stress or injury. Training and socialization. Proper training is vital to ensure animals can work effectively and safely. Equipment. The right gear, leashes, reins, harnesses must be used to ensure control without causing discomfort. Stress and fatigue. Overworking or poorly timed handling can lead to stress, injury, or poor performance in animals. Rest breaks should be provided. Discuss the importance of handling livestock in a humane manner, considering both legal and ethical responsibilities in agricultural environments. What guidelines should be followed to ensure animal welfare? Answer: handling livestock humanely is both an ethical obligation and a legal requirement in agricultural settings. Ethical responsibilities include treating animals with respect, minimizing pain and distress, and ensuring their overall well-being. Legally, the Prevention of Cruelty to Animals Act and the Animal Welfare Act require that animals be treated humanely with specific guidelines for their care and handling to ensure humane treatment. Safe and calm handling. Handlers must use calm and non-aggressive methods when working with livestock, avoiding techniques that could cause fear or injury. Proper housing and nutrition. Livestock should have access to adequate food, clean water, and appropriate shelter. Health monitoring. Regular health checks should be conducted to identify any signs of illness or injury. Minimal stress. Handling practices should be designed to minimize stress, such as using low-stress, stop-and-ship techniques. Training and education. Handlers should be trained in animal behavior, stress reduction techniques, and emergency procedures to deal with injuries. What are the common challenges associated with managing herds of livestock? What are the best practices for maintaining herd health and safety? Answer: managing herds of livestock involves various challenges, including ensuring proper nutrition, preventing disease outbreaks, and managing social dynamics within the herd. Best practices for herd management include disease prevention, implementing regular vaccination programs and ensuring proper sanitation of living environments, proper nutrition, providing appropriate feed based on the nutritional needs of the herd to maintain optimal health and productivity, regular health checks, monitoring for signs of illness, and quarantining sick animals to prevent the spread of disease, handling and moving livestock, using appropriate techniques to handle livestock safely, such as low-stress herding methods, which reduce the risk of injury to both animals and handlers, record keeping, keeping detailed records of health checks, vaccinations, and any treatments administered to the animals. What are the regulations surrounding the use of working dogs in agriculture, and how do these laws ensure the safety and welfare of the dogs? Answer: the use of working dogs in agriculture is governed by a combination of animal welfare laws and regulations that ensure the safety and welfare of the dogs. These regulations focus on preventing abuse, ensuring that the dogs are treated humanely, and safeguarding their health. Key regulations include training and socialization. Working dogs should undergo appropriate training to ensure they are capable of performing tasks without causing undue stress or injury. Adequate rest and hydration. Working dogs must be provided with sufficient breaks, water, and shelter during work to prevent exhaustion and overeating. Health monitoring. Regular veterinary checks are essential to maintain the dog's health and to address any injuries or illnesses. Living conditions. The dog's living environment should be safe and comfortable, with proper shelter and adequate space for exercise. Handling practices. Handlers must use positive reinforcement techniques to communicate with and control working dogs. How does effective sanitation in animal handling environments contribute to the prevention of zoonotic diseases? Provide examples of diseases that could be transmitted through improper sanitation practices. Answer: effective sanitation is critical in preventing zoonotic diseases, which are diseases that can be transmitted from animals to humans. Regular cleaning and disinfection of animal handling environments reduce the chances of disease transmission. Zoonotic diseases like salmonella, tuberculosis, and rabies can be transmitted through direct contact with infected animals or contaminated surfaces. To prevent zoonotic diseases, proper waste disposal. Animal waste should be disposed of safely, as it can contain pathogens that spread infections. Sanitizing equipment. Tools, cages, and any other equipment used in animal handling should be cleaned and disinfected regularly. Hand hygiene and washing with soap and water after animal contact is essential to avoid transferring pathogens to humans. Separation of sick animals. Sick animals should be isolated to reduce the risk of spreading infectious diseases. What are the potential consequences of neglecting proper PPE usage during animal handling, and how can organizations ensure compliance with PPE regulations? Answer: neglecting proper PPE usage during animal handling can lead to serious health risks, including zoonotic diseases, physical injuries, and chemical exposure. For instance, improper use of gloves could result in cross-contamination between animals or between animals and handlers. Failing to wear respiratory protection could lead to exposure to harmful dust, chemicals, or airborne pathogens. To ensure compliance with PPE regulations, training and education. Workers must be trained in the correct use and maintenance of PPE. Routine inspections. Regular inspections of PPE should be conducted to ensure it is in good condition and appropriate for the tasks being performed. PPE policies. Organizations must implement clear policies requiring PPE usage and ensure enforcement through monitoring and auditing. Provision of PPE. Employers must provide adequate PPE for all workers as stipulated by occupational health and safety regulations. What are the ethical implications of animal handling in agricultural settings, and how can ethical decision-making impact animal welfare and farm productivity? Answer: ethical implications in animal handling revolve around ensuring humane treatment, minimizing stress, and protecting animal welfare. Ethical decision-making can directly influence farm productivity by fostering a healthier, more productive herd. For example, ethical handling practices such as using low-stress handling techniques and providing proper care lead to healthier animals, higher productivity, and reduced veterinary costs. Farmers must balance productivity with ethical responsibility, ensuring that animals are treated with respect and dignity. Ethical practices also include ensuring that animals are provided with a safe and comfortable environment, adequate nutrition, and health care. Following ethical guidelines and regulations such as those set by the National Animal Welfare Guidelines helps farmers maintain farm sustainability while ensuring humane treatment of animals.